Welcome, everybody. Thank you for joining today's webinar about the role of oncology social workers. So I'm Gavel from Myeloma Canada. I'm responsible for the educational programs at Myeloma Canada, but also community engagement. And I'm with Emily Barca that you see on screen with her colleague, Joanne CEO. They are both from the Princess Margaret Hospital in Ontario. Welcome.
Thank you.
So before we start, I'm just going to show a few slides for instructions for this webinar today. So thank you to our sponsors. Of course, without them, we cannot build this type of material. You will see on screen a Q&A panel. This is how we will interact today. So you can see both of us on screen. But to ask questions, we will ask you to enter your question in the panel and we will answer them at the very end. So here on the Myeloma Canada website, this is where you can find the recording after the session in the menu bar that you see on screen. Take the time to locate that. If you go down, you will have access to the red channel button. You click on it. This brings you to our YouTube channel page where you can actually find all the recordings of our webinars. If you hit subscribe, you will be notified every time we actually add some material that is new. Just a small reminder that we have an app. It's called MC Lounge. It's pretty much the equivalent of Facebook if you want to join a community and actually chat with other people that have myeloma or caregivers. Also, we just launched the MC Assistance info line, so you can ask your questions to Myeloma Canada staff, which will help you with some questions about services or questions about myeloma, side effects, so on and so forth. So either by email or by phone, we will assist you. Also, a reminder to subscribe to our newsletter if you want to be if you want to receive a communication once a month with all the research updates, for instance, about myeloma. All right. I will stop the sharing now so we can learn more about the role of social workers. So I'm excited because at Myeloma Canada, of course, we get a lot of questions about how to get access to services, resources, or equipment or aids to support them with their myeloma journey. So I'm sure you will be able to give more of the understanding regarding your role and how we can access to your services. Welcome.
Thank you so much. Thank you for having us here today. I'll just start us off. So I'm Emily. I'm a social worker here at Princess Margaret. We're both based in Toronto, but I am from Vancouver. So hello to anybody from BC who's joined us today.
I'm Joanne. I'm the lymphoma and myeloma social worker here at Princess Margaret. I am born and bred in Toronto. You will find in our presentation going forward a little bit, we've tried to look at some more countrywide resources, but we do have more specific to where we are. So we tried to put as many links as we can in the presentation. And if you do have any questions, you could always just pop it down in the Q&A for us.
Yeah.
Wonderful.
Before we get started, we did want to see if there was a way to ask people where they're joining us from today.
So I launched a survey. You should be able to see that in the menu bar or as a pop-up on your screen. So I see people answering, so that works. I will wait a few seconds and we will be able to see. So the question was I made a mistake. Sorry.
It's
Where
okay.
are you from? Miss Tani. So did a typo, but where are you from? Just to have a sense of if you're a patient or a caregiver, from which city, because we're pan-Canadian. So of course we expect to have participants from everywhere. And maybe you can specify if the role of a social worker is usually present in each hospital, or maybe sometimes some of the hospitals or have access to a social worker more in as a outpatient service, maybe. Okay, so we have most of the answers. So we have people from North Vancouver, Guelph, Calgary, Went West, Kitchener, Halifax, Calgary, North Vancouver, Welland,
The
Perth,
West.
Whitby, most Ontario, I would say.
Okay, that's
Welcome, everybody.
probably good for us.
We can answer more specific questions about Ontario, but we'll try to help as much as we can.
For sure. Yeah. All right. So I'm gonna, if I can figure this out, try to share my slides here. Just give me a moment. That's okay. Okay.
So today we're talking about the roles of social work and how we can help you, how you can access us, and then we'll also talk about resources. So some of the common things that we help people with, and then some of the things where we can link you to or how you can access us for these supports. So we are very lucky at Princess Margaret, where we have both outpatient and inpatient social workers. So our inpatient units have social workers, whether it's solid tumor or hematology. And then as outpatient social workers, we are site specific. So Emily, for example, is the social worker for folks who are getting CAR T, as well as some GI patients. And then I focus mainly on lymphoma, myeloma, and auto transplant patients. So hospital social workers are can be key members of your oncology team. In Canada, a lot of us are master's trained, and we also go through specialized training to provide care to oncology patients. Usually, if there are social workers as a part of your team at your hospital or at your cancer center, you can speak to your oncologist or the nurse or another member of your healthcare team and to make a referral. And then at some hospitals like our own, you could call our department of psychosocial oncology directly and and you can self-refer to us and ask for our support directly. Yeah. So I like to say to patients when I'm first introducing myself that we provide two types of support. One part of it is the emotional counseling and mental health support, and the other part of it's the more practical healthcare navigation systems and resource part. So with emotional and mental health support, we provide one-on-one counseling with a lot of our patients. It's time limited, but we do the best that we can for the patients that we are servicing. Sometimes there's also in-person groups or online support groups that social workers facilitate. And then it's also connecting caregivers to support programs. So for example, at Princess Margaret, we are very thankful that we have a caregiver clinic that's run by one of our psychologists. And with regards to healthcare navigation, we help people try to get the right services at the right time, whether it's community services that they need or trying to link them up to other services in the hospital, whether it's cancer rehab and survivorship here, for example, or linking to one of our dietitians, or even getting in contact with a doctor because they haven't heard back yet. We try to help patients get discharged safely from home if we're working on the inpatient units, making sure that resources are in place, if the correct referrals are in place for home care, for example, or for equipment that's needed. We help try to facilitate that. And then also exploring rehab or long-term care, or in some cases palliative placements and things like that. So depending on what the needs are, we try to help navigate the healthcare aspect of things for folks. Yeah, go for it.
Okay, so the other thing that we help people with is accessing practical and financial support. So that includes helping people access income benefit programs, which could be, federal programs like EI or CPP, as well as provincial social assistance programs. We help link people to different community resources, such as transportation programs or other types of community supports. Sometimes we're involved in housing or helping people access, for example, shelters, helping people apply for subsidized housing in some cases. We also help with insurance and drug coverage issues. And in our hospital, we're quite lucky because we also have a team that specializes in connecting patients to drug coverage. So that's our medication reimbursement specialist team, if anyone ever ends up being a patient at our hospital. And of course, social workers are involved in many other types of activities. Our roles are very clinical. So we might not be doing all of these, but you really can find social workers at many different levels of the healthcare system. We're involved in advocacy. We conduct research. We do program development, and of course, advanced care planning. Okay. All right, so I'm going to talk a little bit about financial supports. So this obviously is a huge part of, a cancer diagnosis for many people. Unfortunately, it's not just the emotional impact, but the financial impact that causes a lot of stress for people. So there's different places that people may be eligible for benefits. People may have short or long-term disability if they are an employee, or I've had a few instances of patients who happen to take out a private disability policy if they were self-employed. But I will say that's very rare. I probably could count the number of patients who had those policies on one hand that I've met so far in my career. And then we have our federal government benefits. So these are benefits that would be accessible to people across the country. So we have EI and specifically EI sickness benefits. In the last, year and a half or so, these were extended from 15 weeks to 26 weeks. Which has made a huge difference for people. And then for people that are going to be off work for longer, we have CPP disability benefits. And those would be sort of in place for people until they reach 65. Both of these two programs, EI and CPP disability, are based on there's sort of two criteria. You have to have made the minimum number of contributions in terms of how much you've worked and paid into these programs. And then they're also based on a person's healthcare situation. So then each province has their own social assistance program. So this is where we're going to focus a little bit more on the Ontario ones, just because we really can't speak to programs in other provinces. But my guess is probably that they're quite similar across the country. So in Ontario, we have the Ontario Works program. So this is social assistance that's available for people that they might be sick, and that's why they're not working, but they also just might be unable to find employment. So it's for people that have low income and low assets. And often we have our patients apply for this while they're waiting for other programs. I'm not super familiar with programs across the country, but I believe, for example, in Alberta, for people who are from Calgary, there's it's called Alberta Works, I think, so quite similar. And then we have the Ontario Disability Support Program, or more commonly just ODSP. And this is a disability version of social assistance. The asset limits are a little bit higher. And you can also, you can work on both of these programs, but the ability to work is a bit more generous when you're on ODSP. I think if I'm remembering correctly, because I worked in Calgary for a year, the Alberta equivalent to this is called AISH. We have this link here to a booklet that was developed by our colleagues, and it's basically got all the programs that are available to patients and caregivers in terms of financial programs. It is Ontario specific, so that's just one thing to keep in mind. But if that would be useful for anybody, that's an option. Anything else?
I would just note that the disability benefits, so CPP disability and ODSP in the case of Ontarians, is that the wait time for those applications to be assessed is a few months. So with CPP disability, it's up to 4 months. With ODSP, it's up to 6 months. So we usually always start with either EI or Ontario Works, depending on folks' situations. So there is a waiting period. And in the case for myeloma patients, because the cancer is more chronic, more long-term, the wording in the documents that your doctors will need to sign, you would need to ask them to say that your disease is long and the return to work or the return to normal, quote unquote, is unknown. So that's just a small aside for you.
No, that's a really important myeloma specific tip. Sometimes trying to figure out how to apply for these programs and get the wording is a challenge, right? And that's where social workers can be helpful, especially if they have experience with the particular illness that you're coping with.
We do also help with the CPP. If your CPP disability application has been rejected or denied, there's an appeals process that we also do help with on occasion.
Mm-hmm. Yes.
So just some general supports for caregivers. The same qualifications for the EI sick benefit also apply to caregivers. So you have to have worked the minimum amount of hours and contributed to EI. But the EI caregiver benefit provides up to 15 works for folks who are quote unquote caregivers. So it doesn't have to be a partner or a loved one or a family member. It could be someone who is like family. So if you have a close friend who is taking time off to help with some time off when you're in treatment, or if you're a loved one who needs to take time off, then those are available to you. In Ontario, we have an Employment Standards Act that is a form that can be filled out that protects your job so that you can take this leave. The leaves are on screen. They're a little bit complicated. If you need clarification, we can definitely go into it, but the information is there, and you can, all of those colored options are linked. So caregiver leave, medical leave, critical illness leave, they all mean different things. So it really it depends on what you need at the time. And then the financial programs, that's the same booklet that Emily had clicked on earlier.
I don't know if I can get back
to it.
That's okay. Okay, so let's talk about drug coverage. So obviously this is a pretty important topic. So first I'm just going to talk about drug coverage programs that are potentially kind of Canada-wide. So some people are fortunate to have extended health insurance from work, school, or maybe they bought themselves private insurance. And obviously plans vary, the amount of coverage varies. So sometimes you may still need to look at kind of applying for your provincial coverage on top of this. That would be kind of a rare circumstance, but it's possible. Then for Indigenous patients who have status, they were able to access benefits called non-insured health benefits, which cover drugs. For patients who are refugees, or refugee claimants, they would be enrolled in the Interim Federal Health Program, or IFH, which also offers drug coverage. And then we come to the provincial drug plans. So this is kind of actually, Joanne found this. I won't click it because it's kind of it's long and complicated, but Joanne found this website if you care to look, with information about every different province and what plans are available in the provinces. But I'm just going to talk about Ontario. So people can get the Ontario Drug Benefit, or ODB, if you are receiving social assistance. So Ontario Works or ODSP, this program as we just talked about. Some people who receive Ontario Health at Home, that's home care. Not everybody, but some people receiving that can get drug benefits for a time-limited period. And then if you are over the age of 65, you also have access to the Ontario Drug Benefit with a little deductible that you pay. If you're under the age of 25, you have access to OHIP Plus. And then for people that are between the age of 25 and 64, you would have access to the Trillium Drug Program. And the Trillium Drug Program is not 100% coverage. It is, they calculate how much you have to pay based on your annual household income. So again, the provincial programs are going to vary based on where you live. And if you have questions about that, you can ask a social worker, you can talk to a pharmacist. As I mentioned, at our hospital, we do have medication reimbursement specialists. You may also have them at your hospital. I know that's not a unique to Princess Margaret thing, but I'm not sure if you'd be able to access them everywhere. So you can talk to a social worker or a pharmacist. All right, I'm going to talk about transportation now. This is another really important topic for people. So this slide is more so about benefits, again, that are potentially cross-country. So you may be familiar with the Canadian Cancer Society, and they have a few transportation programs. The one that I think is most widely available is the Travel Treatment Fund. It is for lower income patients. They do have an income cutoff for this, which is what you can find it very easily on their website on the application form. In some provinces, they have a volunteer driver service. We do have that service in Ontario. So you can choose like one or the other program. You, as far as I know, you can't have both. And then you may be familiar with the Lymphoma and Leukemia Society. They have a travel grant for people. And it does, I learned recently from Joanne, it does include myeloma patients. I work with mostly with people who have a lymphoma. So anyway, I learned that recently. So it's for people that are traveling more than 30 kilometers to the cancer center, and somebody does need to apply for you. It doesn't need to be a social worker, it just needs to be a healthcare provider, but just keep in mind that there are limited applications available each month. And then again, we have the non-insured health benefits program for our First Nations and Inuit patients. And just a point of clarification, as far as I know, this covers the cost of traveling from sort of far away, like say Sudbury to Toronto. It does not cover intercity transportation. So just keeping that in mind. And then lastly, maybe you already know this, but if you live a certain distance from the hospital, if you live more than 40 kilometers away, you may be able to claim some of the travel expenses on your taxes. But as you know, of course, we encourage you to consult an accountant or someone more specialized in taxes than we are. And you can also find the information on the CRA website. They have a little finder tool, and you just search the word travel, not transportation. Transportation will not get you the information you're looking for.
So specifically to Toronto and Ontario. So in Toronto, we're very lucky that we have the Wheel-Trans service that's run by our transit system. So you would just have to ask a healthcare provider to fill out the application for you. Most of our patients do qualify because of the immunocompromised aspect of things. And then also if there's some kind of a gait aid that's needed. So if you're using a cane, or if you're finding it, walking long distances is difficult, we can apply for Wheel-Trans for you. There is also like a cross-city program too. So if you're outside of the city, but you border Toronto, we can also apply to them, and then they'll drop you off and Wheel-Trans will pick you up. And it's just the fee of the transit. If you're on Ontario Works or ODSP, we can also ask for support through them for medical transportation. Ontario Works is a little bit more complicated, whereas ODSP, there's just a form that we need to fill out and send in and have the doctor sign. So not too complicated. We just state the number of visits that you have, and they'll set you up with a taxi account if that's what you prefer. There's also a reimbursement for if you're driving yourself. And then 211 is also a really good way of looking for some supports in your area. Some local community organizations have medical transportations. Some of them are volunteer based, so it's free. Other ones are fee for service or based on kilometers. So if you're in the Toronto area, there's iCare, iRide, and Toronto Ride. So those are the two. And then if you're coming from Northern Ontario down to a center, doesn't have to be ours, but if you're traveling from Northern Ontario, then there's also the Northern Ontario Travel Grant that's available. Yeah.
One thing also, I think 211 is a cross Canada number. I think I sort of was Googling it with different provinces, and I didn't do all the provinces and territories, but the ones that I Googled seem to all have a 211 option. So so you should be able to use that across the country as well. Okay, parking, everybody's favorite topic. So in an ideal world, you wouldn't have to pay for parking at the hospital, but anyway, you do most of the time. So most hospitals do have discounted parking options. So like, I know it sounds basic, but just ask, because if you are not using this, there probably is discounted parking. Sometimes it takes a bit of coordination, but if you're at the hospital fairly often, it's worth it. At our hospital, there's like, depending on what parking lot you're trying to park at, there's different options. There's parking passes or discounted parking passes for our lot that's right behind Princess Margaret, which is on Murray Street. And then Princess Margaret is part of the University Health Network, which is five different hospitals, right? Yeah. So there's also discounted parking passes from UHN, and just some other ideas, right? There's like websites you can go to find parking deals. In Ontario, you can get an accessible parking permit, which is like it's a blue sticker you put in your car. And I believe if you park at city-owned parking lots, then the parking is free. Again, that's a provincial thing, so please check, the sort of equivalent in whatever province or territory you're in. And then, of course, some parking lots charge half price if you enter before 9. Just another deal.
The accessible parking permit needs to be filled out by a doctor, and you need to meet their criteria. So it's usually like there needs to be a physical limitation of some sort for that one. So that's good. Yeah.
All right. So powers of attorney. So this is kind of a particular topic of interest of mine. So I'm sorry in advance if I go on a little bit about it. But I know this can actually be quite a difficult topic for a lot of people. So I just want to acknowledge that as well. I sort of try to think of it as kind of like a form of self-care. By doing these documents in advance, you are taking care of yourself and trying to look out for yourself in the future if you ever needed them. So many of you may be familiar with what powers of attorney are, but I'll just do a little explanation. So every province and territory, has different legal documents allowing you to appoint somebody to make healthcare and financial decisions for you if you can't make them yourself. One really important point that sometimes people get confused about is these documents are not the same thing as having a will. So these documents are for when somebody is living but just is unable to consent to different things, to say healthcare or to unable to manage their financial affairs. Okay, so in Ontario, there is a power of attorney for personal care And this is a legal document that gives somebody the power to make choices about somebody else's care if they're not able to make them for themselves. If you do not have this document, then there is a hierarchy of people that can make decisions for you. And so say you have somebody who is married and living with their spouse. So their highest ranked decision maker in the absence of a power of attorney for personal care would be their spouse. Say you have somebody that is not married and both of their parents are deceased, but they have a 32-year-old son, then that son would be their decision maker. So it's pretty logical, but as you can imagine, there may be some situations where maybe somebody doesn't have family, right? Or if someone wants a person who's not the person highest ranked in the hierarchy to make decisions for them, then it's very important to do this power of attorney for personal care. And it's also very important to make sure that all of your healthcare providers, that you see on a regular basis, have that. Sometimes I've had patients sort of say that, oh, they gave the power of attorney at one hospital, and so they assume, and it's a completely fair assumption, that then we would have it, but that's not the case. So if you're going between different hospitals, it's good to, if you're not going to give them a copy, at least to tell them who you've appointed in a power of attorney. Make sure they have that person's contact information, and also good for your, if you have a family doctor, for that person to have it as well. Then we have power of attorney for property. This is a document giving someone the power to make choices about your assets. I'm not a lawyer, so please don't take this as legal advice, but I believe that this document may also be used if, say I appointed Joanne to be my power of attorney for property because I was going to be out of the country and I have, an apartment that I own. And so she's going to act on my behalf to manage that apartment while I'm away. So I'm not incapable, but I'm just giving her that authority. I'm unavailable. But you can do this document and you can say that you only want it to come into force if you're incapable, at least in Ontario, right? This document is different. Again, this is Ontario specific, but if you don't have this document, there is not an automatic hierarchy of people that can make these decisions for you. It's not the same as the power of attorney for personal care. Right? Yeah. Okay. So there's a great website. I'm just going to bring it up here for a second if I can. It's Advanced Care Planning Canada. They actually have information for all the provinces and territories, different resources. Go to Ontario, for example, and there's actually specific Advanced Care Planning Ontario website. So there's lots of information. I think there's a workbook somewhere on this website. Here we go. The online ACP is Advanced Care Planning workbook. So there's lots of good stuff there, and you can just go to whatever the area is where you're living, right? So, and just a point, sorry, advanced care planning, that you may be familiar with this term, but it's like an umbrella term which refers to kind of thinking about what your wishes and your values are. And then making sure that your wishes and values, as it pertains to your healthcare, and making sure that people that would be making decisions for you or just your loved ones know what they are. And it includes making documents like powers of attorney. And then for Ontario, this will take you to a website that just talks more about powers of attorney. And then this link here will actually take you to a free kit, and it has a power of attorney for personal care and one for property. And this is produced by the government. I have found what looks to me like an equivalent sort of free kit for BC. I'm not sure if there are equivalent ones for the other provinces, but this is a really, really good thing to talk to a social worker about. And if you obviously if you have more questions, or say you have kind of a complicated situation, especially financially complicated, you might also want to talk to a lawyer as well for some additional advice. All right.
So we take a hard turn from, or not, into the emotional impacts on patients. So a cancer diagnosis is always a hard thing to experience. As the person hearing the news who has the diagnosis, as a loved one, as a friend walking next to another. So there's a lot of uncertainty that comes along with a diagnosis, because we don't know what the future will look like. We don't know how much of the future is left. And so then the emotions that come forward might be fear, might be anxiety, which could lead to some depression, some hopelessness and isolation, sometimes anger, and then also the feelings of not wanting to be a burden to others, or not wanting to let other people down, or uncertainty about the future and what it might hold for other people or people in your lives. So to cope with it, we oftentimes talk to people about what is valuable to them, like where do they find meaning, where do they find joy, what things do they enjoy doing, either by themselves, with people. It's really about being gentle with yourself and forgiving with yourself, because it's nothing that you did, right, that caused you to have this with myeloma, right? And it's also, like, if you're speaking with young children, right, it's nothing that they did either, right? So and so it's allowing yourself to feel your emotions, to sit with them, to understand that what you're feeling is quite normal for somebody who's going through this, right? And then trying to find people around you. Who's your network? Who are your people? I often ask, like, who are your people? Like, who do you go to? Who's in your phone calling you or sending you messages, and like, who can you rely on? Who are the people you can depend on? So try spending some time with them, right? Try to figure out what a routine is like when this happens, because oftentimes we lose a lot of control when there's a diagnosis of cancers and myeloma, right? Sometimes it's like your time is not your own anymore, your body is not your own anymore. There's a lot of things that you are experiencing. And so connect with your loved ones, spend time with them, and then also connect with things that make you, right? Is it your spirituality? Is it your creativity? Is it something active as much as you can while you're going through this? And maybe consider participating in a support group. Myeloma Canada has some amazing ones. I've heard the Toronto chapter is excellent. But I know that there's chapters all over Canada. And then the impact on families and relationships. A lot of the times, what we find is that when there's a diagnosis of cancer, some people really, really step forward. But we also find that sometimes people step back, and we don't know why, right? It might be their own experiences. And so cancer is very, very social of a physical disease. So it doesn't just impact the person who has the diagnosis, right? It's not just you that has the myeloma, it impacts everybody around you. So if you have a partner, if you have children, even your friends, right? If you don't have a partner or kids, right? Or coworkers, right? And so, and everybody experiences distress in different ways. So that's also quite normal, to be distressed on behalf of a loved one. Because there's also a helplessness to that, right? You're not the one that's going through the diagnosis and the treatment. So it's quite, it's quite normal to feel discombobulated, I guess, in those situations. And so a cancer diagnosis can also shift roles and relationships within families and support systems, right? So being now having to step up and doing more of a supportive role. But caregivers are really the what we always say, the invisible backbone to the healthcare system, because without caregivers, we can't do most of what we do, right? They're often the ones like driving our patients to the hospital, making sure that they're getting their medications or fed. So yeah, the work that you do as caregivers and of loved ones, as friends, as communities of folks is really, really important. Here's some resources. There's lots of links. Again, Myeloma Canada, amazing groups available. The Lymphoma Leukemia Society of Canada also covers, it's blood cancer, so they also have groups as well. And so Canadian Cancer Society, Wellspring, they have physical chapters as well as online resources. And then if you're a younger person, the Young Adults Cancer Canada also has amazing groups, mostly online. Another resource that we love is Look at Feel Better. And so they run free virtual workshops as well as in person in some places. And those, it's a fun time for some of our patients. Yes, that's our contact information. Our emails are there. You can feel free to reach out to us, but if you have any questions, please. Oh, I thought we put in a question. Go back. No. Please put it in the chat.
Thank you so much. Actually, I'm going to start recording the question. So if you have questions, please use the Q&A option and the menu bar. If you don't get to see it, you probably have 3 little dots that bring you to more options. So you can just use the regular chat. I'm going to make sure to address your question. So in the meantime, I would have a question. So as we discussed earlier, sometimes we do have questions, people coming and asking about, let's say they would like to have a walker because they're in pain or they have bone fracture and it's just for a little short period maybe, so they don't want to buy anything. So we're being asked, so where should we go? Is it accessible for rent, let's say with the pharmacist, or is it something that I can borrow for free? So would you have an answer regarding
we don't have a program at this hospital, at least to rent equipment, but or to lend out equipment. If equipment is needed more long term and the person is receiving healthcare at home, so home care, they can be assessed to see if they qualify for some coverage for that mobility device. It needs to be a physiotherapist that comes in. So a referral would need to be made to healthcare at home. But in Toronto, there are a few medical appliance retailers that do rentals and short-term rentals. So if it's like a 2-wheeled walker, for example, it's not typically super expensive for that because they're not that's not expensive equipment. But if you're talking about like a Nexus where it's the 4-wheel walker with the basket and the seat, then that could be a little bit more expensive for that. Unfortunately, it's limited funding in Ontario for mobility devices. Yeah. So it would, again, this is like a tax thing. You could try to put it in as a medical expense. So that would be the best option, unfortunately. So if you need it for a longer term, like if you need a mobility device for a longer term, I know that there's back fractures are quite common with myeloma patients. And so it's like a cane or a walker. So if it's needed for a longer period of time, I would ask for a referral from your healthcare team to the healthcare at home if you're in Ontario to see if you could get an assessment for a device. What's the program called?
The assisted devices
program?
Yeah.
Assisted devices program, where you can get some of your device covered by the government.
I think it's 75% usually, right?
Up to a certain,
yeah.
I don't know what the top line number is. Unfortunately, I've also pointed people towards like Kijiji and things like that. Right, because if it's like a walker or a cane or something and it's not necessarily needed anymore and it's not necessarily an unsanitary device, you could likely find it deeply discounted online, Facebook Marketplace maybe, things like that. So
for short term, yes, I've seen on those. We have a bunch of Facebook groups for support, and also we have MC Lounge. So I've seen in the different areas people asking to borrow. Basically, like the community is pretty nice. I found there's a lot of collaborative things going on. So I would say definitely ask your community. Yes. And what's fun with MC Lounge is you can get to see members by location. So you get to see people around you. So I would just say ask. Sometimes it's just for a short period, so you don't want to buy. So I understand that. Also, thank you. I see the questions popping. So I would say also sometimes we have patients that do not have a caregiver, so they need more help for, let's say, applications. So would that be something that you could sit down with them and do the applications to programs with the person? Is this something that is being done, or you're just covering like the question regarding the application?
We have, yes, especially with the financial programs. So we've sat down with people to do the applications from the front to the back. Typically, we ask that they bring all of the necessary documents and information. But yes, like if they are not able to, or if there's a language barrier, or if they're quite ill, we can help with that.
So regarding the equipment again, so I had like two comments about the same that in Calgary, for instance, it's not only in Calgary, it applies to all Canada, but Red Cross is a good place to borrow equipment for free. So that's a comment that we had. And a medical provider makes the referral, as you mentioned, physio, doctor, nurse. So thank you for the comment. So of course, a lot of the information that we've seen today was targeted for Ontario programs, but just keep in mind that what you learned today in the different categories of services, just, think, okay, so that's available. I should have access to that type of information or service or help with a social worker. So ask your hospital in each of your area for different programs. So just keep that in mind. So of course, it's recorded. I will make this webinar available on YouTube. So you've seen a lot of links through the presentation. So for one, I will make sure to email back all the participants to thank you for assisting to this webinar, but also you will be getting the PDF of that presentation. So I will make that available to you. If you're watching this afterwards on YouTube, so either you can contact us with the MC Assistance Service, so you can email directly at assistance@myeloma.ca and ask for the resources or the recording. So we can provide that, but I think I will be able to add all the links as much as possible as I can in the description of the webinar on YouTube. So you get access directly on our channel to the links. So I'll try to do that. But in any case, you can contact Myeloma Canada, no problem. And this was very, very useful so far. We don't have any other comments. So I think we're gonna end it there for now. But for sure, afterwards, if you have questions, we can always go back, ask the questions for you, make sure you have access to the information. At Myeloma Canada, two resources I can recommend regarding the information that we've seen today. So we have the mental well-being and relapse resource guide that could help you, a bunch of links also depending on where you live, and the financial implication of living with myeloma that could be useful. Again, different links. So they're not printed copy. It's online only because they're linking out to different resources that are very useful. But I'll make sure to have access to the links that we've seen today. So thank you again, Emily and Joanne, for helping our community of patients, and hoping to see you back soon.
Thank you. Thank you so much.
Thank you all. Have a great day.
For joining. Goodbye.